guys, it's me, Ira, your student nurse on duty from BSM 13D Group 15. And for today's video, we will be doing another turn demonstration, and this time it's gonna be applying a rigid splinting. So please keep on watching. Step number 1 is to prepare necessary equipment for the procedure. In that way, we will be able to maximize our time, our effort, and also our energy in the execution of the procedure or for future activities. Aside from that, it also helps us to become an effective healthcare professionals as it minimizes the incidence of error and interruptions during the delivery of care. Next is to prepare the necessary equipment needed for the procedure. So for the equipment to be prepared, we have here the bandages, triangular bandages. So if you don't have triangular bandages, you can make use of any cloth or any handkerchief that will be used to secure the rigid splint. Then we have here the pair of rigid splint to anchor or to support the injured site of the patient to avoid further damage. So in order to provide comfort to the patient, you can make use of any foam or any clothing material in order to avoid discomfort. And next is for hand hygiene is to make use of any hand sanitizers or alcohol to prevent the spread of any microorganisms. Step number 2 is to check if the scene is safe. So especially in the incidents where the care is being delivered in the outside setting, such as in the road or in the highway, it is very essential for any healthcare professionals or any person who will be delivering the care to check for any unusualities, any barriers, or any safety risks that is found or that will be observed in the patient's environment during the incidents. So of course, first promote patient safety. Second, promote the safety of the healthcare professional or the person who will be delivering the care. And lastly, checking for the scene will also help for the success of the execution of the procedure or the delivery of care. Next is to check if the scene is safe. So the patient environment has no barrier or any safety risk. It is now proceed to continue with the applying rigid splint. Step number 3 is to get a consent from the patient. This action allows any healthcare professionals to preserve the dignity of the patient, and aside from that, it also shows respect to the patient. Hello ma'am, good morning. Ako di ay si Ira Maiso ma'am from Davao Doctors College, a third year student nurse and as well as a well-trained first aider. So karon ma'am, magtaod ko og splints and bandages sa imuhang injury kay para ma-stabilize siya ma'am ba, para dili ta mas maglala ang imuhang injury. Okay lang ba sa imuha ma'am?
Okay lang.
Thank you. Step number 4 is to support the below and above area of the patient's injured site. In that way, we will be able to provide an additional support to the injured site of the patient. You can also ask for help to the patient depending on the capability of the patient to, of course, participate in the delivery of care. If not, you can ask someone, for example, a bystander or your other rescuer to help you or assist you during the execution of care. Next is to support the below and above corner of the patient's injured site for stabilization and to provide support and security for the patient's injured site to prevent further damage and further injury, and as well as to promote patient safety. Step number 5 is to check for patient's blood circulation. In order to check for the patient's blood circulation, you should assess the following: F for filling, W for warm, and C for color. Another reason for checking for the patient's blood circulation is to ensure that the patient's body is adequately receiving enough oxygen. Next is to check for the patient's blood circulation. So you can check for patient's blood circulation by assessing the following: feeling, warmth, and color. So for the feeling, ma'am, malihok ba nato atong mga fingers? Good. Kani ma'am, naa ba kay ma-feel pag ginapindot nako?
Oo.
Good. So while assessing for the warmth, you can also check and assess at the same time for patient's pulse. Pulse is good and is active. Next is to assess for the patient's skin color, because the change in patient's skin color may reflect or may be interpreted for an obstruction of blood circulation. So if there is paleness, obstruction is present, so assess. The patient's skin is not pale and is pinkish, so there is no obstruction. Step number 6 is to apply an appropriate size of rigid splint on the patient's injured site. This is done in order to provide an appropriate support to patient to prevent further damage and injury to patient. Next is to choose an appropriate size of rigid splint or rigid board that best fits for the patient's injured site. So it is important to choose for the right size for patient that best fits for their injured site in order to make sure that the patient's injured site will be supported, will be secured, and will be stabilized to prevent further damage and further injury to the patient. Another thing, you can also make use of pads or foam or any clothing before placing the actual rigid board to the patient's injured site or to the patient's skin to promote or provide comfort to patient. So if you are alone, you can ask for help or assistance to the patient in applying the rigid splints. If the patient is able and is capable to participate to the execution of the procedure, or if not, you can also ask for assistance to the other present rescuer or bystander if possible. So ma'am, magbutang ko og rigid splints ma'am ha, para support ni siya sa imong injured site ma'am, palili siya basta-basta malihok. Pagunit lang ko dala ma'am ha. Thank you ma'am. Step number 7 is to apply bandages on the patient's injured site. It is placed above and below corner of the patient's injured site in order to first to provide an additional support to the patient's injured site, and second is to secure the splints that was placed on the patient's injured site to prevent further damage and injury to patient and promote patient safety. Next is to apply bandages or triangular bandages if present. If you don't have, you can make use of any cloth or any handkerchief to secure the rigid splints or rigid board. So place the bandages on the below and above corner of the patient's injured side to of course provide security and stabilize the patient's injured side. So ma'am, magbutang ko og ano ma'am ha. Step number 8 is to do a recheck for patient's blood circulation. It can be done by assessing the following: feeling, warmth, and color. So this step is done in order to ensure that the patient's body is adequately receiving enough oxygen. Next is to recheck again for the patient's blood circulation by assessing for feeling, warmth, and color. So, ma'am, malihok ba nato balik ang imong fingers? Good. Kani ma'am, naa ba kay ma-feel or mabati pag ginapindot na ko?
Naa.
Good. While assessing for the warmth, you can check for the patient's pulse to note for any unusualities, for any changes. The pulse is good and steady. So next is to check for the patient's skin color for any changes as well. If the patient's skin color is pale, it reflects for obstruction of blood. So the patient's skin is not pale and is pinkish, so meaning there is no obstruction. For the last step is the step number 9, is to bring the patient to the nearest hospital or healthcare facility for further assessment. So stay with the patient until rescue or help arrives. Next is to inform the patient that the procedure is done. So ma'am, humana taog-taod sa splints and bandages. Maghulat na lang ta na maabot karon ang atong rescuer para mag-adto ta sa nearest healthcare facility para mas ma-assess pa ka dito, ma'am. Thank you. After applying for the rigid splints, discard the used gloves to prevent the spread of microorganisms for the patient safety and the safety of healthcare provider, and do as well as hand hygiene. The patient is now ready to be transported to the nearest healthcare facility, but make sure to stay with the patient until the help arrives. So it is important for the patient to be reassessed at the healthcare facility to ensure for the patient's welfare and well-being.